Dr. Dan O'Brien specializes in public health and infectious diseases at Lindenwood University in Missouri, and he predicts that we will see a decline in the coronavirus within the next 2 months due to an increase in research and prevention measures. Now, One America's John Hines sat down with him for an interview. Take a look.
What can you tell us about this virus and its strength or resilience?
The coronavirus, it's a zoonotic disease in which...
what?
Zoonotic.
Zoonotic.
Zoonotic, in which regards it transfers between animals and humans. It's actually been around since the 1960s. And it's a cause of the common cold as well as pneumonia. And it really just depends on where the virus actually attaches. It can attach to the cells of the upper respiratory tract, thus affecting more kind of mild diseases, but then it also can attach to lungs and bronchial tubes, which could create severe infections.
Is there an overreaction to the potential fatality numbers? Potentially, that's what captures everyone's attention. Are the fatality numbers that everybody's seeing in China? Is there an overreaction to that at this time, do you think?
Sure. As we look at the numbers, according to the CDC, 45 million Americans have been affected by the flu this year, with 46,000 deaths. But with the coronavirus, we haven't quite gotten to those numbers, and I think it's due to we only have a few months data compared to years of data with the flu. So I think researchers are still trying to identify the exact numbers and how fast this is going to spread.
In terms of its ability to spread, its ability to infect the host, compare it with the SARS if you can.
Yeah, so the SARS is very severe. SARS is that severe acute respiratory syndrome, which is kind of the end of the sequela in regards to the coronavirus. So I'd say SARS is a little bit more severe than the coronavirus scientifically. And I think researchers, especially working through the NIH, are finding ways to come up with a vaccine. So I think over the next couple of months, we should see a decline due to more research coming out and more preventative measures.
In the next few months,
a decline in the coronavirus.
Was that what you saw? What we saw with the SARS virus was the same sort of development, the same sort of life cycle, if you will?
Exactly, and we saw that with the swine flu in 2009. The H1N1, in regards to the vaccine, was developed shortly after that, and now is implemented into vaccines.
How long did it take for them to develop an H1N1 vaccine?
A few months.
You have been, I'm sure, watching these press conferences in the White House and have been observing the White House activities. Are you satisfied with the response from the administration at this point?
I think they've acted very appropriately and very diligently.
This is the Trump administration now?
Correct. In regards to a very quick response for what we know is a very kind of acute condition, and we didn't know a lot about it at first, but I think they've acted in regards to providing financial assistance or financial, aid or assistance.
What is really important for people to know about the coronavirus that maybe they don't know?
It's very common among all of us, among 80% of the population. It's just how it differentiates from the flu is just different strains.
Dr. Dan O'Brien of Lindenwood University in Missouri, thank you for talking to One America News.
Thanks, John.
Want to see more videos like this? Click on the link below and subscribe to One America News on YouTube, and call your cable provider and kindly demand that One America News is added to your lineup. Call and subscribe today.